I'm Simon. I'm a current PhD candidate here at UCL. I'm working in the tech group. I'm also a neurosurgical registrar working at Queen's Square. My research is based around the application of artificial intelligence to vestibular schwannomas. Vestibular schwannomas are these slow-growing tumours that grow just behind the ear and extend out towards the brainstem. They cause lots of problems for patients, both in terms of symptoms and in terms of need to manage them further down the line. And the research that I do around VS is primarily based around two strands. The first is predictive modelling. So this essentially looks at what can we predict. If you're a patient who presents with a neovestibular schwannoma, what can we look at to essentially predict outcomes down the line? And then the second thing is applying a branch of artificial intelligence called computer vision, which looks at operative video in vestibular schwannomas, again, trying to predict that outcomes down the line. Predictive modelling is really, really important. We do this all the time naturally, just as clinicians. So if a patient presents to you in clinic, again, let's say somebody's presented with tinnitus and some hearing loss. They go to their GP organises a scan and it shows this tumour, this vestibular schwannoma. They then turn up to your neurosurgery clinic, and already as clinicians, we're making certain judgments and assumptions. So we're looking at the size of the tumour, we're looking at the age of the patient, we're looking at the fitness of the patient, and all of these things sort of go into our internal monologue and management plan about how we're going to end up managing this patient. So whether they need surgery, whether we can watch and wait, whether they need a special type of radiotherapy called gamma knife therapy. And predictive modelling using AI, or even simple statistical modelling tests like logistic regression, essentially just formalise that. So they take a look at all the clinical data, the demographic data, the imaging data, they assign importance to each of those variables, and then use those to try and predict certain outcomes. Vestibular schwannoma management has undergone quite a few paradigm shifts in the past 20, 30 years. So the increasing availability of neuroimaging has made surveillance much more of an available option. The increasing availability of stereotactic radiosurgery, so gamma knife, and increasing the technical ability of those machines has made that a much more attractive option. And then also we've seen paradigm shifts from surgeons attempting to take all of the tumour to try to take a little bit less of the tumour with subsequent radiotherapy in most cases to try to preserve the facial nerve and improve function of the patient afterwards. So those are the sort of paradigm shifts we've seen so far. I do think that moving forward, the next sort of paradigm shifts that we'll see will be around prediction. So it'll be better tailoring our treatment strategies to specific patients based on their presentation. Any application of AI in healthcare brings a ton of challenges. You can think of these from a sort of technical and then from an ethical standpoint. From a technical standpoint, if you want an AI algorithm to work properly, you need a ton of data. And that's really, really challenging, particularly in sub areas like mine, like in vestibular schwannoma, where it's a relatively low volume pathology and units tend to work in silos, relatively limited data sharing, which means that getting the amount of data you need to build appropriate algorithms is difficult. Because of that, you can end up developing machine learning platforms that overlearn your data or overfit your data, is the term we use. And what that means is that whilst your algorithm looks really good on paper, it might not actually perform so well in real world settings. And then there's other issues such as implementation. So implementing AI in the most appropriate ways. Some clinicians are a little bit wary about AI, some clinicians are very bullish and keen to incorporate it as much as possible. I think the most important thing is that as you incorporate AI, you need to make sure that the AI is doing exactly what you want it to, so looking at validating outcome measures, but also looking at how clinicians and patients use it and feel about it. So incorporating outcomes such as trust and usability, any sort of assessment metrics. At Queen's Square, we're really lucky to have a very high volume centre for vestibular schwannoma treatment. Not only do we treat a lot of patients surgically, we see a lot of those under surveillance, but also we have this fantastic gamma knife centre, which is a regional referral centre for patients undergoing this special type of radiotherapy that delivers focused beams of radiotherapy at the tumour. So we see patients and patient throughput all the time and get their input on sort of the research that we're doing. We do also have formal patient involvement in our research. Through the research that we've been doing through my PhD, we've been collaborating with groups such as BANA, the British Acoustic Neuroma Association. And it's really valuable, I think, running a sort of research past those groups. You get to know what's really important to patients.